Great. Well, welcome back, everyone. For those of you who were able to join us for our first session, we hope you had some great takeaways from Steve and Patrick's presentation on beliefs, actions, and goals. And now we're going to shift to trauma-informed care, which was a topic of interest to many of our members, understandably. So we are very thankful to have Andrea here to share some information with you this morning. So I wanted to welcome and introduce Andrea Grosskirth with Children's Wisconsin. Andrea is a licensed clinical social worker and a clinical supervisor in the Child and Family Counseling Centers serving Kenosha and Walworth counties in southern and southeastern Wisconsin. So Andrea, thanks for being here, and I will turn things over to you.
Thank you so much. I'm very excited to be here with all of you today. I have never presented to a group of people that weren't in the mental health field before, so please bear with me. I tried to tailor this presentation to the group of you. Feel free to pop in with questions if you have them as we go along. I do have a slide presentation, so I'll just start there. And like I said, please feel free to stop me and ask questions if you have questions. All right, we're going to see how this works out. Here we go. Okay, so what we're going to talk about today is professional boundaries, how to set boundaries with people that you're meeting with, and how to remain trauma informed as you do that. So the goals of our session today are, I'm going to move this so I can see. There we go. Learning how to set boundaries and understanding why they're important, learning how to be trauma informed and provide help while still within staying within your role of expertise, and how to avoid potential pitfalls, what might be red flags regarding boundaries, and how to handle those things. So to prepare for this presentation, I went to the website for the American Library Association and started reading about what values and ethics already were in place for librarians. And so these are what's listed as the core values for librarianship. Some of the ones that relate to boundaries would be professionalism, social responsibility, sense of diversity, privacy, confidentiality. So you already have a good basis there for supporting the use of boundaries. And then this is included in the ethics, the code of ethics for librarians. Some of the relevant items there related to distinguishing between your personal convictions and professional duties, and not allowing personal beliefs to interfere with the fair representation of the aims of your institution or the access to informational resources. So I thought this was really interesting that you already have a code of ethics in place and some guidelines for how to be working in a way that's ethical and includes boundaries. So to compare that, the social work ethics that we use in practice is a 27-page book of ethics, and it does include information about boundaries. There is, as social workers, when we get our master's degrees, we have a whole class just about boundaries and ethics, and we're also required every 2 years to complete continuing education regarding boundaries and ethics. So it's something that we take very seriously in our work, since we meet with clients that are sharing really personal information with us. And so it's something hopefully that I can share with you all. And I'm sure some of you have experience with setting boundaries and how to do that in a way that's trauma informed and ethical. So this will be just a way to build on that knowledge that's already there. Some of the
Andrea, I just wanted to mention too, so we do have some member agencies that are libraries around the state, and then we have many members who are literacy agencies. So still in the educational field, but teaching literacy skills to adults. So we have kind of that group of attendees as well. Just wanted to let you know.
Fantastic. I didn't prepare anything. Regarding educators, I apologize. I'm sure that you have a code of ethics already in place. So I'm going to come from my own background of social work ethics, and please feel free to share with me if there's anything that is a difference. Something that's really interesting is that even between mental health fields, there is a difference in our ethics, our code of ethics. So some of the trainings that I have been to regarding ethics, there are attendees there that are both social workers, professional counselors, licensed mental health providers. And the code of ethics for counselors is actually different from the code of ethics for social workers. And a lot of the information is similar, but between the fields, all of the little details can be a little bit different. So hopefully we have some foundational knowledge across the board, and please stop me and ask questions if there's anything that comes up. Thank you for that. One of the things that I did want to point out regarding the ethics for social workers is that one of our values is competence, and related to that, the principle includes that we practice within our area of expertise, and that we have a level of competence before we start providing services in any area. So for example, I typically work when I'm doing therapy services with children and families. Substance abuse is not an area of expertise. I have worked with some families that have a dual diagnosis, but substance abuse is certainly not my specialty. So if I had a client that came to me and really wanted to work on substance abuse issues, sobriety, like a 12-step program, any of those things, I most likely would refer them to another provider because that isn't within my area of expertise. Okay, so boundaries, what are they and why do they matter? So these are some quotes just from clients and from other people when they were asked about boundaries, kind of what that means to them. Typically, it's about separating two things, understanding where your limits are. I love this one from a kid. It keeps the good stuff in and the bad stuff out. So how we relate that to professional boundaries, they can be both internal and external. So boundaries can be something that you set yourself personally as a boundary because it's what matters to you. It can also be external, for example, something that the program that you're working for sets as an expectation in the work that you do. They're often specific to your role, what your responsibilities are, and what the relationship is with the learner that you are working with. And then they're also informed by the people receiving services. So we will talk in a little bit about how trauma impacts the use of boundaries and how it's how and why it's important to have boundaries for people that have experienced trauma. But certainly that population might need a more clear level of boundaries. And so it is important, depending on what population you're working with, to adjust how you relate those boundaries to people. Why it's important is because it does help in supporting the people that you're serving, the learners that you're working with. It also helps to empower them. If they know what the boundaries are, they can feel more confident in their work with you, knowing where their limits are. And also it can help teach them how to set boundaries so that they can set boundaries for themselves in different relationships. You can be a role model for them in how to set boundaries. It's also important for both your and your learner's health and safety. By that, I mean your mental health and the safety that you have in that relationship. These are very simple steps. I'm breaking it down to the most simple steps here for setting boundaries. And then we're going to talk more in detail about this. So identify the need for a boundary, make it clear, use clear, kind language to set that boundary. And then if you have to, enforce the boundary. So here's an example of a statement that would be too flexible, that doesn't show a boundary. Feel free to stop by anytime. So that's something that we might say if the expectation is that people can stop by anytime. But if there's an expectation for when you're available or what you're going to be doing during certain times, then a clearer boundary would be, you know, for example, I'm available Monday, Wednesday from 10 to noon to help out with applications. If that time doesn't work, here's my email and you can schedule another time. So that provides a clear boundary of when you're available, and alternate if that time doesn't work. And it just makes it clear to that person what the expectation is. So how can this be a little bit different for somebody who's experienced trauma? People that have experienced trauma typically have had a breach of boundaries in some way. It might be a physical breach of boundaries. It might be a breach of their boundaries related to time or money, or their personal values. And so it's really important for people to have that sense of safety, to be able to know in their interactions and relationships with you that they know where the boundaries are. And I just want to think for a moment of a time, if anybody has experienced a time when somebody else had made plans, like maybe group plans, or maybe it was like a date that somebody had planned, and they just said, you know, let's get together on Friday afternoon. What we do is going to be a surprise. And I want you just to think about like how much anxiety that might produce, to not know where you're going, or what specific time you're going to be leaving, when you'll be coming back, how you're going to get wherever you're going, what you should wear, all of these questions that are unanswered, and how much kind of anxiety that can cause. And there's a similar level of kind of stress and anxiety when people don't know where their boundaries are. It really does provide a sense of safety when you tell people if there's a limit and explain what that limit is. Okay. So how do we do this? This is just an example. So for people that have experienced trauma, if they may be sharing information with you that is too much, it's information maybe about their histories that is either too much trauma for you to hear, or it's inappropriate for the setting that you're in. These are some different ways that you can move that conversation to try to get yourself in a different place. So the first one is more detailed. I'm sorry that you've been through such a difficult experience. I would like to help you, but that's really not within my role. I am here to help you with, and then whatever it is that you're working on. I also have a list of community resources, so if you would like to get some more support, I can tell you where you can go for that. So it is helpful to have, if you are a helper that has experienced people opening up to you about their trauma histories, it is helpful to have a list of community resources that provide counseling or support. Maybe there's support groups in your area. Certainly there's online resources. There's hotline numbers that can be used nationwide. So if you have a list of resources handy, that's helpful to have for these conversations so that you can give people that direction of somewhere to go. A couple other shorter responses, you could say to somebody, I'm sorry, but I'm not comfortable hearing about this. Can we get back to whatever it was that you were working on? Or if you're somebody who has experienced your own trauma and what they're saying is bringing up your own memories, you can say to that person, what you're saying is triggering something in my own history. I'd rather not talk about this any further. That's a clear boundary, and then you can move back to what you were doing. Okay, these are some simple prompts that help to start boundary conversations. Either I would rather, or I'd rather not, I can or I cannot. This does or doesn't work for me. In certain situations, you can be very clear and just say, please do not, or I'm not comfortable with. If you are concerned that there might have to be enforcement of boundaries where there's some specific consequence sent, you can say, if you continue this conversation, then I'll have to end our session, or I'll have to leave. So you can certainly prepare people with those consequences so they know if there's a breach of an ongoing breach of boundaries, how that will be handled. Sorry, my screen's stuck. There we go. Okay, so this is from actually professional nurses have a what they call a zone of helpfulness. So the ideal is to be somewhere in the middle. You don't want to be either under involved or over involved. So under involved can look like avoiding interaction with people, trying to find other things to do when people need help or are seeking out your services. This is common when people are feeling burned out or have been triggered. It can also be common for people who are more anxious and are concerned about an interaction. Maybe they feel like they're not prepared, or they feel like they aren't going to have the information someone needs, so they under involve. They stay kind of in the background to avoid that situation. The opposite of that is being over involved, which is typically comes from a place of wanting to help. It typically comes from it's not typically somebody that's maliciously trying to do too much. Typically it does come from a good place, but what happens is people become too involved with their learners or their clients, and they're going outside of their role or expertise. So sometimes we'll see this in more extreme examples, people that want to rescue or save the person that they're working with. They want to be a hero. They want to be seen as like the person that made everything better. And so it comes from a good place, but it just ends up usually causing more issues. Okay. So these are some red flags or potential pitfalls that can happen related to boundaries. Sometimes people disclose too much or inappropriate information. They might be giving too much personal information, which can lead to people thinking that that you are more of a friend instead of a helper. It is important in our relationships to be friendly, but to not be friends with the people that we're working with. It's important to still maintain a sense of professional boundary there. Another thing that can happen is either mind reading or making assumptions. So sometimes when you've worked with a population that's experienced a specific trauma, so let's say, for example, people who are refugees. When I lived in Massachusetts, there was a large refugee population that we worked with. And it's important when you're working with one population that you don't start seeing all of the people in that specific population as kind of experiencing the same thing. So even though they may experience some of the same traumas, having experienced being a refugee, all of their histories are going to be still personalized and individual. And so you don't want to make assumptions because you find out, for example, like somebody is a refugee or has experienced domestic violence or is homeless. You don't want to make assumptions about what that means for their experience, and still let them tell their personal stories. You also don't want to take anything yourself personal in what they say. Sometimes related to the next item there, sometimes people who have experienced trauma will project onto you. They might do some transference of feelings. Maybe you remind them of somebody that was helpful to them in the past, or maybe something about you reminds them of somebody that wasn't helpful in the past. And so there may be some projection of feelings. And it's important not to take that personal, but to still set the boundary with them if what they're saying or doing is inappropriate. So some red flags that you might see related to boundaries, if you suddenly start spending more time with a specific learner than you do with other learners, or you start treating them, you notice that you're treating them differently than you do other people, that's a sign that there's a boundary being crossed. Also, if you believe that you're the only person that can help them, so you're separating yourself from other potential helpers, and again, trying to avoid that rescue role. If you're seeing somebody outside of your work role, in social work, we call that a dual relationship, and it's very much not allowed. But if you're seeing somebody outside of your work role, you want to assess if it's appropriate or not. And in some situations, if you are providing services in a very small community, that might happen. And so it's just important to be self-aware and to assess whether or not it's appropriate. And then if you start discussing with a learner topics that promote secrecy, that encourage a sense of intimacy or self-disclosure, that's a sign that you're getting too close and there isn't a clear set of boundaries. So as I said, it's important to be really self-aware in this process. So you want to ask yourself questions. Am I saying yes when I really want to say no? That's a sign that you need to set a boundary. And that's for your own personal mental health and so that you don't burn out in your helping role. Are you people pleasing? So again, that's oftentimes doing things that you don't really want to do. Do you find yourself avoiding certain people or certain people that are asking for help? Are you avoiding providing services? That's typically a sign of burnout or that you're doing too much. Do you feel like you're being taken advantage of or disrespected? So those are signs that you need to set a boundary. If you feel like you're being taken advantage of, either your time or your sense of expertise, then maybe you need to limit the amount of time that you're spending with that person. Certainly, if you feel disrespected in any way, it's important to set a boundary about what language is allowed or what interaction is appropriate within your relationship. And then in assessing boundaries, it's helpful to notice your own physical body, because if you notice when you are around certain learners that you start feeling more tense, or you're holding your breath, you're looking for an exit to the situation, you feel like you're rushing through the interaction, or if you feel like your emotions are getting more escalated or closer to the surface, those are all signs that there's a boundary being crossed. And so we can oftentimes, if we are aware of our bodies and assessing what's going on within ourselves, it's going to give us information about if we need to set a boundary. All right, and so then these are some tips for how to handle things if there's a boundary that's been crossed. So for example, if you're working with a learner and they, I'm trying to think of a setting that might take place. So let's say you're working on, I saw that today some of the sessions were about English language learners. So let's say you're working on language with a learner, and in that process, they start telling you about their trauma history. You can pause that conversation and say, you know, one of the prompts from before, you know, I'm uncomfortable with where this conversation is going. Can we get back to the lesson we were working on? If there's an ongoing violation, the first time, you want to assume that the person wasn't really aware that they were overstepping their boundary. Maybe it was an accident. And so you just very clearly, again, state to them what your boundary is. We're talking about something that's off topic. Let's get back to what we were doing. If another boundary is crossed, or it's the same boundary is crossed again, you want to use firm language again. And if it makes sense in the situation, to let them know what the consequence will be if it gets crossed again. So for example, what we're talking about is off topic. I really want to cover this material with you today. If we can't stay on topic, then we're going to have to reschedule this session. And then the last step, if the boundary is continually crossed, is to, again, make clear what the consequence is and enforce it if necessary. So you've already made that boundary clear. You've already told them what the potential consequence could be. So that third step would sound like, we've already talked about how it's important to stay on topic. We only have a limited amount of time to meet today. If we can't focus on what we're supposed to be getting done, then we're going to have to end and reschedule. And then, like it says, then you have to be prepared to actually end the session if somebody can't follow through. So last thing that I just want to say, and then I'll take time for questions because I'm sure people have specific situations they might want to talk about, that setting limits will not disrupt a healthy relationship. If there is a sense of professional respect between the learner and you, and that is a healthy relationship that's already being set up, then setting a limit with them is not going to all of a sudden make that relationship uncomfortable or make them not want to meet with you. It should just continue as it was, and you should be able to have that relationship without it making things harder. Boundaries are a part of healthy communication and healthy relationships. So it is a helpful thing to do in your relationships with learners. All right. Those were all the slides that I prepared for today, but I did want to allow us to have time so that if people had questions, we do still have about 15-ish minutes. If people have questions, we can go through some specific examples of times maybe that a boundary needed to be set, or we can talk through how to work with learners who have experienced trauma.
Andrew, I just had a question in terms of, you know, the different steps and tips for creating boundaries. And I probably won't ask this in a clean way, but so a lot of our agencies are obviously serving students or adult learners who for whom English might not be their native language. You know, you mentioned refugees and kind of coming from a different background. Can you share any specific tips that might, you know, be especially suited for working with adult clients or, you know, adult learners in those, you know, in the setting the boundaries, especially if it's kind of an, you know, an educational setting or a tutoring type situation?
Yes, thank you. That's such a good question. It's so important um to be culturally considerate when you're working with people, especially if English is their second language or third or fourth language, or if there are cultural considerations, maybe because of somebody's religion or because of the way their family is structured. There's so many different cultural considerations that can impact how you're setting boundaries. And so it's really important to try to be aware of those things and to remember that that we also are learning in that relationship with how to interact with that other person. So sometimes I will ask clients of, you know, of various backgrounds questions about their culture and how that might impact the way that we're interacting. So for example, saying something like, is there anything related to the culture that you're a part of that might impact working with a woman? Or is there anything because of your cultural background that limits when we meet? You know, certain people can't meet, for example, at certain times or certain days. So that opens up the conversation to be able to gather more information about cultural differences. And then if there is potentially a language barrier, it's that much more important to just be succinct and clear about what the boundary is. So setting up ahead of time, trying to be proactive, what it is that you're going to be working on. If for example, you are working on language learning with a learner, then setting up that relationship at the very beginning with telling them like, okay, we're going to be focused on lessons related to learning a new language. That time is supposed to be very focused. If we get off track, I'm going to try to keep us on track. Being proactive can make that conversation easier when it does come up. And so if we have those conversations at the start, then it doesn't feel as awkward when you have to have them, maybe if we start getting on track. And I will say that the longer you work with somebody, the easier it is to get into a more familiar kind of relationship. And sometimes it starts to feel less of a professional, like helper learner relationship. It does start to feel more familiar and casual. But we do kind of always have to remind ourselves that we're playing a specific role within that person's life and development. And so we want to try to stay within that role.
Great. Thank you.
I want to just read a chat, a message from Anna that I think is really important. So she recommends that programs have a clear protocol of when volunteers should contact their tutoring coordinator or volunteer coordinator when they feel like a boundary is being crossed. And I think that, yeah, we try to set boundaries through our tutor learner contracts or other those, you know, setting the relationship up for success at the beginning, and then that clear follow up when there is an uncomfortable situation.
Yeah, I think that's so important. Even within the setting, you know, that I'm in right now, I work at Children's Wisconsin as a supervisor, clinical supervisor, and I'm able to provide that support to the clinicians that are providing therapy services. And even within our roles, having, you know, been through all of the trainings and ongoing trainings about ethics and boundaries, stuff like this still comes up. And so If you're somebody who maybe doesn't have as much of a background in setting boundaries, it can be really uncomfortable that first time somebody pushes you, or starts to kind of try to see how far they can stretch those limits. And so it's really helpful if you have somebody else that you can talk to be able to work through how to respond to that, and to get some perspective maybe on whether or not what's happening is appropriate.
Yeah, and I thank you for that comment. It really, I think that's important. And I know everybody on this meeting is working with different populations. And I think it's okay to remember, for those of us working with non-native English speakers, we might be able to clearly see that it's not so much pushing boundaries, it's a cultural difference, or there's no bad intent. And it's still okay if there's if a boundary has been crossed, it's still okay to touch base with your agency. And there are lots of solutions that will be very successful, but it's always okay, no matter what the intent is. It's always a good idea to touch base with your agency. So I hope I'm explaining myself clearly, because sometimes we find ourselves in situations that are very uncomfortable. And we know clearly that it's not bad intent, but
Yes.
it's still uncomfortable, and we might still need help navigating it. And that's okay to ask for help. It doesn't mean that you think your learner's bad or anything. You're just asking for help to keep the relationships safe, I guess.
Yes, absolutely. I mean, this is a example that, doesn't really necessarily have any serious consequence, but in most agencies where I've worked, if I've been doing home visiting, which can be already tricky with boundaries because you're going into somebody's home. And so you're the person that's from the outside coming in. Typically in those agencies, there's a rule that you can't accept food from the homes that you're going into. But in many of the homes, especially when I would work with people of various different cultural backgrounds, it was expected in their culture to provide something for people that came to their home, something to eat. And so in those situations, it would have been very rude for us coming into the home to refuse that that offering. And so in those situations, even though there's a difference in boundaries there, where the rule is supposed to be, you can't accept food, you have to find ways to make that still comfortable for both of you. So, not expecting them to feed you dinner because you're there. But you can say, thank you, I actually just ate. Or I have a lot of allergies, I have to be careful about what I eat. There's lots of ways to still make that limit set without also offending kind of the cultural background.
And Anna, I think you got your hand raised.
Yeah,
Oh.
I just want to say thank you so much, Andrea. I've been looking for a training exactly like this for many years. And so I appreciate you bringing your experiences, and especially when you shared that even in your experience as a mental health provider, that you have limits that you set. So for example, you're not an expert in all areas. And I appreciate that, because I think what I have seen happen is that as instructors or tutors, we want to be the person, we want to help people. And sometimes we step in and might trying to help, but in some cases can end up harming the situation because we're not equipped to be able to respond appropriately, or we don't know the other nuances, or and so I really appreciate even hearing that for you as a professional, that you can't even help with all situations. And so Thank you so much for sharing your experience, and again, and all the specific examples that you shared as well. I really appreciate that.
Oh, I'm so glad. I wanted to make this helpful, so I'm glad that it was. And yes, I think, like you said, certainly it almost always comes from a good place that people are trying to help. But sometimes you end up getting into a situation where then you've kind of dug yourself a hole and you're trying to help, started out trying to help and ended up doing too much. And then you've went past your area of where you can be helpful anymore. Um, and and then it's hard to dig yourself back out or climb yourself back out of there. So recognizing where your own limits are in your expertise and being able to share those with people, and absolutely always saying, I really do want to help. I wish that that was something that I was able to help you with. But let me give you a resource for where to go. And then it still provides an option for somebody on how they can get that help with somebody, like you said, who's trained to do that.
We have another comment from Susan. And Susan writes, I think setting a boundary is only one piece of this. In a past role, I was capable of setting the appropriate boundary. However, I didn't perceive that I had any way of influencing my own feelings about it.
Thank you for that. And good job setting the boundary. I think that's definitely the first step, that sometimes even people have a sense of feeling uncomfortable doing that. So good job. What I'm getting from the second piece of that is maybe how to handle, like, if you feel uncomfortable in that situation, or if it makes you anxious.
I can be more exact.
Thank you, Susan.
So I was doing a job where I was looking for work for people, and I had a state phone, and I had specific hours, and I always said, you can leave a message outside of office hours, but I don't look at the phone outside of office hours, which I did. I was very good at that. I'd get home and I'd put the phone in a drawer, and on Friday night I'd put it in a drawer and not pick it up till Monday morning at 7:30. But then, like, there would be like a crisis over the weekend, and so I pick up the phone at 7:30 on Monday morning, and like see this whole thing, like text after text. And like for some of these people, I really was kind of their only person. Or like you tell people, like, okay, I can't, this isn't a thing I can do. Like, I don't know anything about housing. These are the people you have to contact about housing. And you know that even if they contact those people, there isn't going to be a solution because there's a horrible housing shortage. And so like I would find myself worrying about my clients, like when it was 20 below, like where are they? Are they living in a snowbank? And I never figured out a way to stop thinking about them. And like at some point I was dreaming about them. In the end, I left the job because I couldn't stop all these thoughts. And I took a job that has a more, like, now I only have to solve one problem, which is whether people are reading or not, which is a huge problem, but it's only one. So I don't have it as much as I used to, but I think like I would never go back to a job like that because it wasn't specifically setting the boundary. It was like how I felt about the fact that I had set it.
Yes,
if that clarifies.
it absolutely does. And thank you. That comment raises the importance of self-care when you're working in a helping profession. Whether it's providing mental health or whether it's helping teach learning skills, you're a helper. And that, I mean, doctors, EMTs, firefighters, all of us that are in these helping professions experience a level of stress because we're putting our sometimes our own needs secondary to other people's needs. And so it's really important to engage in self-care, and that could be a whole nother hour-long plus training. Certainly, I've been to day-long trainings on self-care because it is so important, but you have to be able to figure out how to balance that that need to provide service, to provide helping to others, with maintaining your own sense of health and mental health, and just taking care of your own needs. And so oftentimes in my own role, I do a lot of supervision with clinicians about the need for self-care. And in the example that you set, I think, or that you shared with us, certainly I've been through situations before where you are concerned with a specific client. It's like you can't get them out of your head. You're really worried about them even when you're outside of work hours. Those are all times within my profession that we seek professional supervision on a case, because sometimes it's too much and there's something else that needs to be put in place. Your own welfare shouldn't be so negatively impacted when you're trying to help others. And I'm glad, Susan, that you were able to find a role that was a better fit for you, because all of the signs that you were talking about, like dreaming about clients and worrying about them outside of your work hours, all of those things are signs of burnout. And so I'm glad you were able to find another role. Certainly, I think it's important if you are having some of these red flags of burnout, or you're experiencing a lot of working with clients that have trauma, or working with clients that are in situations that make you feel really worried for them. It's helpful to have your own therapist or counselor, or to have somebody that you can talk to about those situations, so that it isn't kind of just all on you to carry that around.
I like this comment Cynthia put in the chat. Crossing boundaries and being humane are often in conflict. And so I think folks in our profession, we're in our profession for a reason. And yeah, I agree that it can be a tough balance. And I also just want to read, Deb says, excellent reminders. That she's used these strategies when orienting jail tutors, and then as issues arise, but wants to be more purposeful in reminding tutors of these strategies, especially in the corrections setting. That's so important.
Yes, absolutely. Good comment.
Well, we have just a few more minutes. Are there any other questions that anyone wanted to unmute and ask or put in the chat? Right.
Well, thank you guys so much for being such an interactive audience. I really appreciate that you raised some of the questions that brought up some more discussion, and I hope that the information provided was helpful. I'll make sure that my slides are sent, a link to them are sent so that they can be made available. And I'll put my email contact in the chat, so if anybody has ongoing questions, please feel free to contact me.